Early on, I knew that I wanted to go into medicine. So I studied neuroscience in undergraduate, and I became fascinated with the nervous system and all these pathways and how they make us who we are and how we function. And so I went into stroke neurology specifically because it is a specialty that allows me to do some complex problem solving, but also make real and sometimes immediate changes in patient lives. I see patients both in the emergent setting, in the emergency room, and when they're admitted to the hospital, as well as the outpatient setting. When patients come to see me in the clinic, I want to make sure that I've had the chance to review any imaging that they may have had, as well as outside records. And I also want to make sure, most importantly, that the patient understands what's going on in their brain. I'll oftentimes sit down with them and go through the imaging. That might be the first time they've ever had a good insight into what's going on. And I want to make sure that at the end of the visit, they have a clear understanding of what the next steps might be, whether it's further diagnostics, treatment plans, lifestyle modifications. It's my job to make sure that we address their agenda, any questions that they may have had prepared. I want to make sure that we take the time to address that first and foremost. When patients also come and see me, I want to make sure that we address three things. We need to understand what caused their stroke, how do we best prevent future strokes, and how do we optimize that rehabilitation process to get them back to their normal lives. The most rewarding part of my job is just kind of the day-to-day impact that I have on patients' lives. I find it very meaningful playing a part of their journey, whether it's in that acute urgent setting and watching them recover and regain some motor function that they may have lost or language deficits that they may have regained, as well as in the outpatient setting. It's equally rewarding when we've come up with a treatment plan, the patient has worked hard in rehab and has come back to see me. And sometimes you can't even tell they had a stroke. And that to me is very meaningful and significant.